Hello friends, thanks for tuning in. So today, I'm coming at you from Northampton, Massachusetts. And today we're at the Northampton Vision Specialists Facility, an amazing place where I'm really excited to be with my special guests here, both doctors of optometry, Dr. Elizabeth Hannigan and Dr. Naomi Clay.
Mm-hmm. Yep.
Thanks so much. First of all, thanks for taking the time.
Thanks for having us.
And you readjusted your schedule for this. This is like very generous of you because you're busy, you have so much going on, but I'm excited to be here because you are doing things that I've never heard of before, actually. Right? And so our good friend, who's right over here, right? Our friend Crystal is here, and she made this happen. Thank you, Crystal.
Thank you, Crystal.
So I'll just say this: I travel around the world and I teach, and I learn. I do more learning than teaching, but I do a lot of teaching. So when I teach, I learn, right? But what I'm learning over the past few years is how important it is as human beings to integrate all of your systems, right? We have muscles, skeletal, fascia, nervous system, but not many people think about the visual, the vestibular, and all this other stuff. And what I love about what you're doing is this full integration. And basically, I just want you to share with my audience, like, what is your mission here? What is your specialization?
Well, we're doctors of optometry, but we're neuro optometrists, developmental optometrists, functional optometrists. There's different words for what we do. But basically, the take-home message is vision is a brain process. It's not just the eyeballs as this separate thing from the body. Vision is all about how you gather the information, how you process it and make sense of it, and then, like you said, how you integrate it and use it with all of your other systems. It doesn't happen in isolation.
Yeah.
So we're looking at vision in that sense of the word.
So without the brain, your eyes are worthless.
Vision happens up here.
Yeah.
The eyes are just the end organ, just the sensory, the first step.
And a lot of people think that, it's just, can you see clearly? Can you read an eye chart that's 20 feet away? If you can, then your vision is fine. But what happens is, 70% of our sensory input is all visual. It tells us where we are in space, where things are in space, how to move through space, how to be able to, use both eyes together and see single images and create a three-dimensional world. So it's a lot bigger than just can you see things clearly. And the information that comes in, it needs to be efficient and it needs to be accurate in order to integrate with the other sensory systems and tell your body what to do. And so at our practice, we do vision and learning evaluation, so developmental optometry. We do our neuro optometry where we assess people who've had head injuries, like strokes and concussions. And then we're also doing sports vision as well. And the goal is to make the visual system as efficient and as accurate as possible. And so the vision and learning aspect of it is that where kids that are struggling with reading and they get labeled as having a learning disability, and 1 in 4 kids have an undiagnosed vision problem that can heavily influence the way they're learning. So we assess the kids, and also we're seeing a lot more adults too because of the amount of computer screens that people are on that are completely affecting their vision. And they get headaches, double vision, they get eye strain, they lose their stamina when they're reading things, they lose their place, misread words. And then, do you want to talk about the concussion visions that we see?
Yeah, so there's a lot of vision that happens and vision integration, and when it works right, you don't even notice, it just kind of happens. But when someone has a brain insult, whether it's concussion or a stroke or anything like that, everything is effortful. So you're working too hard to just navigate through space, to just move your eyes to the right place. You lose visual field, and we do lots of treatments to stimulate multisensory. So vision, vestibular, auditory, all at once to kind of reset the brain almost.
So I have a question. So you take these, can you describe to us when you look at this input through the eyes, now you're doing multi-sensory, right? Like, how do these integrate? If you could go in like to a little bit of scientific terms, like in the brain, like what's happening with all these systems? Like the end result being all of them integrating effectively. What does that look like?
So it happens in the midbrain. That's where everything happens. And unfortunately, that's with head injury, kind of what is the easiest to get injured.
Really?
And I think this is a really good time, possibly, or we'll show you later. We have a demonstration that shows how vision is the king. Vision overrides other inputs. So we'll show you something where even though you know something to be true, if your eyes and your vision are telling you something, that's what your system believes.
Sure. That's we can even splice that in right here later.
Yeah,
right?
perfect.
That'd be a good time for it.
That'd be great.
So in the brain, I'm curious to know, is this anything to do with, let's say, any kind of neural firing patterns that are happening, like with synaptic neurons that fire together, wire together, they say?
Yes.
How much of that are you looking at? Because it sounds like it might be quite a bit.
Exactly. Right. And when we do vision therapy, I always tell patients we call the activities eye exercises, but that's just for ease of talking about it. It's not the eyes, it's the brain.
Yeah, right.
And it's not that we're building muscles, it's that we're changing, like you said, the neuromuscular pathways.
Okay.
We're laying down new pathways when someone comes into the office once a week, and then through repetition and the mastery of tasks at home, we're strengthening those pathways so they become the new normal for that patient.
I love that. The new norm, I think, is another thing I've been discovering as I travel. In different areas, like, not to get off track, but pain. A lot of people have pain, and they've adjusted to this new level of pain. That becomes their new baseline, and all of a sudden, like, if they all of a sudden get that pain taken away, they can't even believe, this happened to me, how much better they feel.
Right,
it's like, oh, why did I let myself stoop so low? So this can happen with vision.
Definitely.
And I imagine a lot of other areas too.
The classic story, talking about more traditional kind of vision, is the child who puts on glasses for the first time and they say, oh my goodness, the trees have leaves. I thought it was supposed to be just this blob.
Oh.
Or we've had people in this kind of optometry. Right. We've had people who said, I thought I was supposed to see two of everything. Yeah. What do you mean?
Oh my gosh.
I think a couple of kids have said, oh, I thought words moved around on the page. I thought that's
just how it works.
I had no idea. I was just telling Crystal on the way in here, every time I meet with anybody, really, I always learn, right? Like, and my perspective shifts. Like, it just shifted just now. Like, I had no idea that anybody would think that words were supposed to move.
Right, if that's all you know.
That's your experience. That's what you've learned. And
wow.
You don't know any better
and
until someone
brain
shows you a
saying they
training.
move when they actually don't move.
Yeah. Right. And that's back to where learning is a big part of where we see a lot of patients. If you can imagine, if you're working incredibly hard just to get your eyes from word to word, or if you're working hard just to try to fuse the image together, of course you're going to have less to devote to the higher level things like comprehension and
or it's going to take you a lot longer than other kids.
Might be why I was such a bad student in college. Because I read so slow. I was telling Crystal, how are we in here? Because actually I wondered about that with myself, not to turn this towards me, but I will for a minute, because it is interesting. When I read, it's oftentimes very difficult to go through every line. When I try to read multiple words at once and then retaining anything is
you need some vision therapy.
I probably seriously do. Because when I hear something, I'm the audiobook king. Like, I don't remember anything I hear. I read it, forget about it. So I think there's I may have been one of those undiagnosed 50 years ago kids, 7 years old, having difficulty. And the teacher's like, not understanding why I'm having difficulty. I wonder if you can give me an example. So let's say you have somebody come in. No, let's do this first. Is there, and if there is, what is the most common thing you see or that you treat? What would be the most common condition or problem?
Convergence.
Yeah.
So what should happen is the two eyes should always be aiming together in space. Okay. So we're talking about binocular vision or eye teaming. So in the distance, your eyes should be parallel, kind of looking at infinity. anything that's closer than that, your eyes need to turn in or converge to some degree so that they're aiming together.
Keep it as one.
Exactly. And
Okay.
the closer something is, the more your eyes have to converge. Convergence insufficiency is when your eyes are not converging efficiently or automatically.
Oh.
So anytime you're doing anything, let's say arm's length and closer, which is where school mostly happens, reading and writing and computer and work, it's more effortful than it should be. They're working hard to get their eyes to work together, to converge, and the longer they ask their system to do it, the more demanding it becomes.
Okay.
So it can limit visual stamina, it can mimic ADD symptoms in kids. So physically they can't hold their eyes together, so they have to kind of disconnect and look around, and it can seem like they're just distractible, but it can be based on this very common visual dysfunction.
I might be learning about myself. Seriously, because like this, first of all, I was in college several times in my life, and recently, a couple years ago. What I find is when I sit down to read a textbook, I go right to sleep, because it's the most, I have to put so much effort into it, it's overwhelming, and done. I translate a lot to audio in this robot kind of voice, and that helped, but I'm wondering if, is it possible that maybe some of the kids or people out there don't have ADD and they really have a vision problem?
Yeah.
And that is
Definitely.
ADD maybe overdiagnosed?
Yeah.
Sure. I would never say that someone doesn't have that something in
Sure.
addition. Vision, I would never say that vision is the only thing going on for anybody, but
Sure.
certainly, I think
Yeah.
you hit
And
the
if you
nail on the
don't-
head.
And if you don't address the visual issue, they're not going to get better, and you won't know for sure. I mean,
It's
vision is the primary
You
source.
said
The initial
70%, right? 70% of your sensory input?
is visual.
Yeah.
Right.
I've always said, I don't want to jinx myself. I would rather be deaf than blind, because I have a hard time visualizing things. As soon as I shut my eyes, the images automatically become warped.
We can work on that in vision therapy.
Really?
Yes.
Oh man, I am in the right place. Whoa! But I can make up any sound in my head,
Right.
and I like my sounds that I make in my head. But I would never want to be blind, because it's
Yeah.
to me everything it's too important to see things. I love
For
seeing
most of us,
things.
that's the main way that
Yeah.
we get information about our
Yeah.
world and how we interact with our world.
Yeah.
Again, vision is king.
Yeah, and I have a lot of patients either in exam rooms or in vision therapy, and they're like, well, what does this have to do with my eyes? And I'm like, well, close your eyes. Can you do the activity? And they're like, no. And I'm like, that is the primary,
Oh my gosh.
input.
Right?
Is
So we do a lot of things, back to the integration that we were talking about at the beginning, movement in space while doing something visual or using your vestibular system and your
Oh.
balance. And we were talking earlier about how we're working with sports vision, so more than just remediating visual issues, which is what we've been kind of talking about, sports vision is kind of taking it to the next level, enhancing your vision.
Okay.
So pretty much all professional sports teams and athletes, they do vision therapy as part of their training.
Oh.
Like they do
I did
conditioning.
not know that.
They do, yeah.
It makes sense though, right? Because you can, again, I was talking to Crystal this morning, we were walking and she's talking about how that can put you just give you the edge.
Exactly.
Your
Exactly.
performance edge, and all it takes is just a little bit sometimes to be
And
the winner.
anyone that participates or competes in a sport, it's a visual motor performance.
Yeah.
Anything that comes in through our eyes tells us where to perform, how to perform, when to perform, and if your motor reaction or your performance is only as good as the visual information coming in. And if that's not accurate, that's not efficient, you're going to be slower, you're going to have slower visual motor response.
When and where to hit the ball, where your opponents are on the field, being peripherally aware of everybody else, everything going on,
Sure.
split attention visually.
So not only, helping with eye teaming and focusing and tracking, we're also helping with response time, reaction time, taking in as much visual information in, say you're on a soccer field, you need to be aware of, where your teammates are, where the defenders are, where the goalie is, where the boundaries are. Also, tracking a moving soccer ball while you're moving as well. So it's a lot of visual
And
components.
it's simultaneously, because you have all the players, they're all moving probably, or potentially in the ball,
Yeah.
and yourself,
Yeah.
and your relationship to where you are and where you want to put
I always
the ball.
love when someone kicks a corner kick, because just if you're an offender, you have to be aware of that. You also have to make sure that you're not offsides, know where the goalie is, know where the goalpost is. There's so much going on.
Yeah.
And so what we want to do is kind of train that, athlete to be, to make sure that their visual system is the best, so that their motor performance can reflect that as well.
So I'd like to talk more about sports in a minute.
Mm-hmm.
I want to go back now. Let's go back to this convergence, did you say?
Convergence and sufficiency.
Okay, insufficiency. So our eyes tracking properly so that everything is, they're following and it's one, right? Like,
Two eyes are
you're not
aiming
seeing
together
two.
as a team. Exactly.
So can you give me an example, give us an example of what would you do to help this person? What type of therapy?
Mm-hmm. Mm-hmm.
The other thing to add, I mean, we see this with kids, but also people have concussions.
Mm-hmm.
I mean, most of the patients that we see end up having convergence insufficiency due to their concussion as well. So we're seeing the kids. I mean, we're even seeing adults that haven't had concussions, but when someone has a concussion, they're complaining of headaches, eye strain, double vision. They have really difficulty time reading and using the computer, and I would say the majority of the time they have convergence insufficiency.
Yeah.
So let's say a person walks in, they have this problem. What's the first thing you do? You're doing assessments and testing?
Mm-hmm. Mm-hmm. So we do functional testing. So if we do the normal eye exam pieces, we check refractive error, we check eye health, we do dilation, those kind of things. But most of the time when we have a new patient, they say, oh my goodness, I've never had a comprehensive exam like this. Because we're looking at, like we've been saying, vision in a broader sense than just clarity and health.
Right.
So we'll do an assessment, and depending on what we find, that'll tell us kind of what to do next. So we do intervention in terms of passive intervention. So we do eyeglasses with therapeutic components sometimes. So medical tints or filters, prisms, and a prism is just a lens that bends the light. Sometimes we do...
Would you have a demonstration?
We
This is so cool.
bifocals or multifocals,
Yeah.
even in younger people,
Wow.
to support the focusing system. And then in terms of active therapy, we do, like we've talked about a little bit, vision therapy, where we're actually rewiring the brain and reteaching visual skills. So some things are deceptively simple, like a ball suspended from the ceiling on a string that we have move in an arc, and we're watching it while we're in motion. We can add red-green glasses and targets and vestibular demand. Other things we use VR, virtual reality devices, we use 3D televisions, we use all the different technology, and it's a process. It's not a quick fix. It's reteaching the brain. We also use phototherapy or light therapy to stimulate different parts of the autonomic nervous system. So
what is light therapy? I've heard of it.
Yeah. So the most common thing that most people know about is for seasonal affective disorder, how some people do therapy for light, and that's not what we do here, but that's just the example that's well known.
Right.
But we use light therapy, depending on what wavelengths of light we use, it stimulates either the parasympathetic or the sympathetic nervous system.
The rest and digest and the fight or flight systems.
Okay.
So we use it. We can use it to help people sleep better. We can use it to help people with anxiety. There's a whole host of
headaches,
things.
brain injury patients.
That's amazing.
Right.
Yeah.
So you have this person in, and you're using these different techniques or therapies for just helping the overall vision and whatever else, right? So, I don't know, maybe now's a good time for demonstration if you want to. In fact, what I'll do is I'll just stop the camera and then we'll just turn it on and do a demo.
Sounds good.
Okay, cool. We'll be right back. Good.
Oh goodness.
Okay, so we're going to do a demonstration here. What is this?
So this is Fit Lights, light training. So this is something that we use very often with our sports vision.
Okay.
So she's trying. So this is Crystal, and she's going to be our patient.
We're welcoming my friend Crystal.
Hello, hi everybody.
I'm so glad you're with us.
So she's going to try to hit the sensors as fast as she can, and
Okay.
she's going to use her feet and her hands, and we can set this up in any configuration for depending on what the sport is. But for now, we'll do kind of a combination of both.
All right.
So if you want to come in the middle,
I'm ready.
here.
Get your stance ready.
All right. Try to take in all the information at once. Really keep your peripheral vision open. All right, and here we go. Oh, switch. That's okay. Nice job. Faster.
Más rápido. Más rápido. Practicame español todos los días.
Nice job.
She's fluent in Spanish, that's why I said that. And I go to Mexico all the time, so I'm getting better. This is awesome. So tell us what's the end goal with this? What's our goal with this particular
So to improve
technique?
your reaction time.
Reaction
you
time.
see the
Love it.
light, you have to take in where the light is,
Yep,
and then
and then
your
react.
visual system has to tell you which hand needs to connect with it or which
Okay.
foot.
Okay.
So it's as fast as you can go.
And
All
your
right.
average reaction time was 0.958 seconds.
Very good.
Excellent.
Yeah.
Is there a name for this? A name for the?
We just call it light training.
Okay. Awesome.
So
Oh,
this-
1 second.
Yep.
All right, so this is visual or virtual batting cage. So we're going to be putting different balls into the machine, and it's going to pitch them towards the patient, and the
Okay.
camera is going to get to be the patient in a second. So
Okay.
you'll see it coming towards
This is
you,
great.
and you're going to try to identify. Let's start it easy. You're going to try to identify what color the ball
I want
is
to put these.
as soon as it leaves
Okay.
the machine. Okay.
Okay.
But we can make it harder and do identifying X's and O's and numbers.
Okay.
All right, so it's going to come towards you, and it's not going to hit you, but it's going to be quite loud. Okay?
I'm ready. Yep. That's fine. Whoa. Whoa.
And see if you can identify what colors.
Orange. First one was red.
Good. And here's the next one.
Purple.
Want to do X's and
Yep, I'm going to do some X's and O's.
Whoa, orange.
You're progressing, Carl.
Oh,
So as soon as you can tell.
orange. I mean,
All right,
red.
now it's X's or O's. This is much more challenging.
Okay. Oh.
That's okay. And you can bounce on the trampoline a little bit.
Oh.
Sometimes we add strobe glasses,
Oh, wow.
prism glasses. There's lots of levels for everything. All right.
I have these on right now just so you can see what I'm wearing. Okay. That is really cool. And that is for another reaction type of thing?
Yeah.
Identifying.
Processing, how quickly you're able again to take in the information and be able to identify, what color it is or what
And like I
shape
did,
it is.
I identified most after I saw them hit the
Yes,
ground.
Exactly.
How often does that happen?
That's
Initially, yes.
Right.
Yeah.
But then as you keep doing it, repetition, just like practicing
I love
for
it.
any sport, you get better and better and better.
I love it. And go.
So these are called prism goggles. So what they do is they bend light in
Okay.
a certain way, and what we've been talking about is how much vision influences what we learn or what we think. Or so let's try the demonstration. So do you want to?
Sure,
So
yeah.
You're gonna.
I'm going to be
You want me to-
on the trampoline again.
No.
Oh.
We're just gonna use this edge here.
Oh, okay. We're using this edge here.
Yes. So what you're gonna do is you're gonna feel it. So you're looking at it and you're feeling it.
nice and straight.
Is
right?
it straight
It feels, well, I mean, this part here?
when you're looking at it?
No.
No.
No, it's
doesn't feel
diagonal.
This.
Oh, you mean that? That feels
Yes.
straight. Yes,
Yes,
I'm sorry.
yes,
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 yes, I'm sorry.
So now you're gonna put these on.
Okay, so I'm going to put these on.
Yeah.
Do you want to hold
Yep.
this maybe? It's rolling and we can just like, so is it like this?
Yep.
Very stylish.
Oh boy.
So now you're gonna look at
So
this,
profile.
and does it look? You're gonna be actually facing it.
Oh no, so it looks like this.
So now you want to feel it while you're looking at it, and does it still feel straight?
Oh boy, that's hard to say. It's smooth But no, well, so my hand is going with what appears to be a contour or a slight curve. But, so that kind of makes it feel like, I guess it's not straight.
Yeah.
Yeah.
So it's your visual system,
Yeah.
even though you saw it before that it was straight, and now that you're seeing it curved, it's influencing the way
It kind of feels curved.
Yeah. New profile pic. Wow, that's cool.
Yeah.
Okay. So this technology then would help with what will that help with? Ultimately, what's the end goal with this?
So a lot of times when we use these, so the prism goggles shift space in a certain way. So it's your ability to see your visual environment and be able to adapt to it.
Recalibrate.
Yeah, so normally when we have those on, sometimes we have people like throwing a beanbag into a bucket, and if we're shifting everything up, when they throw it, they'll overshoot it. And then we kind of ask them, what could you do? And then what they have to do is kind of recalibrate their visual space and adjust to it. And also by walking around and trying to, avoid objects. And it's how quickly they're able to adapt to their new environment and their new space.
So it's stimulating neuroplasticity.
Yeah.
Okay. Oh, I love that.
Yeah.
All right.
And sometimes we can use that same kind of technology. It wouldn't look anything like this, but
Extreme amount.
This is extreme. But sometimes we can use prisms like this for people who toe walk to help them kind of change their space, and it actually can change them to be walking more normally, that kind of thing. Or if someone has a visual field defect, sometimes we can use prisms to help expand it a little bit, or help them be more aware of what areas are missing.
Okay.
Yeah.
Awesome.
It's pretty cool.
I love it. We are rolling.
So this is the Brock string, and this is kind of a classic, and it's deceptively simple, but this is very, very powerful in terms of vision therapy. So what we're going to do is have Crystal look at this bead here, and can you explain to us what you're seeing?
Yep, so I'm seeing an X. Obviously, I know that there's one string that I'm holding in my hand, but it looks like an X where the green bead is closest to me, and the X is crossing at the green bead, going through with two strings going on either side, and the other side of an X crossing behind the bead.
So that's using a phenomenon called physiological diplopia. You can only really focus in one area in space at a time. An example is if you're driving and there's a bug on the windshield. If you look at the bug, the background is double, or if you look through it, you actually see two bugs. Exactly. So it's using that phenomenon. But what it tells us when she's seeing one bead with two strings in and two strings out, so the X happening at the bead, it tells us that the fact that she's seeing two strings means that she's using both eyes. She's not suppressing or turning off an eye, because that can happen even if someone has both eyes open. The brain can be getting information from just one eye. Okay? So two strings means that both eyes are working. Two strings going into one single bead means that both eyes are working together. So both of them are turned on, and they're aiming together.
So our goal is to see two strings.
For this particular
and
activity.
One bead.
Exactly.
And one bead, okay.
And then we would have her then switch her fixation to a next bead, and the X will jump. If your eyes are working correctly, jump to whichever bead you're fixating on.
Okay.
And now when she's looking at the yellow, you'll probably see two green and maybe two reds, foreground and background.
The name of this again is
Brock string.
Is that the Brock, B-R-A-A?
B-R-O-C-K.
Okay.
Yep. And then she would go back and forth between different targets, and we would bring this closer to stimulate that convergence that we were talking about, and kind of go back and forth, stimulating convergence. And this is kind of the base level, and we can add prism flippers, we can add red-green glasses, strobe glasses, we can add having balance board, exactly, we can add different angles.
Oh my gosh, that's so cool.
There's lots of demand that we can add.
So our goal with this then is to create better convergence.
Exactly, the binocularity and the eye teaming.
Okay.
And doing it this way, bringing it closer, is for convergence. Sometimes we might have it go out to stimulate divergence.
Is any of the lack of convergence or deficiency related to muscular issues in the eye, or is it always the brain, or how does that work?
It's the neuromuscular pathways for the most part. Certainly someone can have a paralysis or a muscle restriction, but the vast majority, it's not that there's anything physically in the way or physically wrong. It's the neuromuscular connections.
Okay.
And another thing that we can do with this is for athletes as well, like specifically baseball players, like pitchers. If they're kind of, holding the ball like this and you see where the target is, and a lot of times, if they're focusing too close, means that they might be throwing the ball in the dirt too much. So they're perceiving things as too close. Or if they're seeing it too far away and the beads aren't together and the strings are crossing further than where they think their eyes are pointing, then they're probably throwing it over the catcher's head. So we also try to help them get a better idea of where things are in space, which helps with, pitchers and batters and all other athletes.
So what I'm wondering is, Crystal, like, what is this experience like for you? Have you done this before?
Yeah, it's in my weekly vision therapy.
Has
for a while
the
now,
feeling or experience of doing this changed at all since you started the therapy?
Yes.
And what was it like before? What's it like now?
So I've known about the Brock string through reading about it for over 6 years since I had the surgery that caused all the problems. At that time, if you can imagine, I could only make my eyes team if the bead was at my nose tip.
Oh, okay.
And now being able to breathe relatively easily and take my eyes from the close bead, you can see my eyes are diverging, and I can actually reach the red bead over there, 4 or 5 feet away.
Right.
I mean, I never thought in a million years in my life that I'd be able to use my eyes together, let alone do this. So.
Wow, that sounds like good news.
An amazing,
that's really nice.
amazing success story.
That's really good.
Hard worker.
These guys saved my life, really. There would be no reason for me to get up out of bed every day if it weren't for Northampton Vision Specialists and the whole team here.
Well, bravo to you. I love it. Okay.
It's true. It's true.
But that's what it's all about. We're in this. We're in this to help people, right?
Exactly.
This is why we do what we do.
Exactly. Yeah, I have been misdiagnosed diagnosed with unhelpful descriptions of what my eyes did, that were focusing on symptoms and not on the functional cause behind them. And because I had symptoms of moderate to severe brain injury, but my eyes still could do things, but at a very high effort. I sometimes struggle to receive empathy and understanding from, individuals and organizations that are actually very well-meaning, but there needs to be more awareness raised about this kind of functional visual disorder.
Right, so this has been really fun, first of all.
Super fun.
But even more so, it's just really interesting, because from the demonstrations we saw, and I got to participate in one of those, that was really cool. We're really looking at what I consider to be some advanced therapy, compared to what I've seen anyways, and helping to make those systems, the visual, the brain, retrain the brain, help people with vision. We were talking off camera about how, I do what I do, they do what they do, so we just want to help people improve their quality of life.
Exactly.
And I think we're both dealing in areas that have a lot of, I don't know if neglect is the word, and sometimes I think it is. Things are systems and diseases are neglected, or methodologies, techniques, strategies to help improve people's quality of life. And so I love what you're doing. That's kind of what I'm trying to say. It's like I love what you're doing. And so what I would wonder if you could do is, do you have a takeaway message that you want people to think about or just think of every day? What would that be? I didn't tell them I was going to ask this question. I do this at every interview.
Well, one thing I'd say is that visual dysfunction can be a silent disability. It doesn't have to be an eye turn where one eye is visibly not working together. It can be someone can look completely the norm, and it can appear that there's nothing wrong, but they can be struggling significantly. And the other important thing is we can do something about it. Is this kind of therapy exists, and a lot of times we have people that come to us and they said they've been to 10 other eye doctors and everyone tells them they're crazy and nothing's wrong with them. So
we just deal with it.
Right, and we have people in tears all the time saying, thank you, you're validating that something is going on and giving me hope to go on. Yeah,
it's interesting. I think that, first of all, it's really nice to see that you're doing the stuff you're doing here. I mean, if it happens anywhere else in the country, I don't know about it. Maybe it does.
It does.
Probably does. But it doesn't seem like it's mainstream, though.
Right.
Would you
At this
get-
point, it's not yet.
Not yet.
One thing I would say is COVD is the College of Vision Development, and that's a really great resource. You can locate a doctor that does this kind of optometry anywhere in the world.
That's
And
cool.
it's not everywhere. We have people coming from 3 and 4 hours away to see us,
Or from England.
or from across the world. So it's not everywhere, but it's becoming more and more
That's right.
prevalent.
And that's good to see. I'm really glad to see that. So another thing too, I just had a random stream of consciousness here. So basically, one of the things I'm understanding is you can have structurally very healthy eyes, like perfect health, but they don't work. Because
Exactly.
it's the brain, it's not the eyes, right? Okay.
Exactly.
Okay. And I think that's the silent visual dysfunction you say? Yeah, I think that's actually, I've never really thought about
Silent
it.
disability.
Today I've learned a lot about that. I think it's very interesting. And it's something that we need to be thinking about. And I always say this like the end of the interviews because, my son is a doctor. He's one of those ones he wants to help people. He wants to look at all the things, right?
Yeah.
And I know we need our medical community, we need our doctors, but we also need insurance companies, we need other entities to get on board, because there are things that we can do, that they can do to help people, to improve it, and sometimes a little bit goes a long ways.
Right.
We'll be in a workshop, I was telling Crystal earlier, with this person with Parkinson's, and maybe we teach them how to roll over. And we've had people all the time who, every workshop is a person who can't roll over. Well, every time, where's the wood? Not no wood, somewhere. That we have 100% success in teaching them how to roll, because it's not rocket science. But guess what happens? And I'm sure you see this all the time. And this is one of my spiel at the end, is because it's really my passion and my mission to really get the word out there. There's so much to do, because when you give somebody a technique to use, whether it's visual or they can roll over now in bed for the first time in 5 years and the caregiver doesn't have to help. You can take somebody who's feeling depressed and defeated, switch it just like that. As soon as they start to see hope, and it's real hope, it's not false, their thoughts change, their movement changes, their life changes, caregiver lives change, other people's lives change. And so you're changing lives, and I know this, and I commend you for your work. I commend you for it. And as I always say, seek these people out. Seek out the people who are really doing the things to change lives, because when we change one thing in a person, it can change everything, and it can just flip them 180, and all of a sudden they become, instead of defeated, they're fighters.
Exactly.
I'm going to see well. I'm going to walk well, wherever it is. So I really appreciate your time.
Thank you
So much. Crystal, thank you.
Thank you, Crystal.
We have an interview coming with Crystal very soon too. We're going to do an interview. So
See you soon.
Yeah. Well, thanks again. Okay.
Thank you.
So much.
Great to work with you.
Great work you're doing, and we should follow up in a year or two and see what else you're doing. Right?
Yeah,
Science,
definitely.
technology, always
To
do.
change, yeah.
Exactly.
All right. So I'm done with my spiel, and thank you so much for watching, and thank you again.
Thank you.
All right. Have a great day.